Let us look at breast cancer. Breast cancer occurs inside and around a woman's breasts. To understand how it happens, let us first see what breasts look like. Nipple and areola are parts of the breast. The areola, which is the darker circle at the center of the breast, and the nipple, which is in the middle of the areola. Could you be at a risk of getting breast cancer? Let's find out. If your mother, aunts, or grandmother on either your father's side of the family or your mother's side of the family ever had breast cancer, then your chances of having breast cancer increases. Not having children increases a woman's chance of getting breast cancer. Lack of breastfeeding is a health risk for both the mother and the child. Being significantly overweight or obese might make you more vulnerable to breast cancer and other diseases. Unhealthy food means an unhealthy body. Try to eat things that are good for your health. Vegetables, fruits, dal, chapati, and rice should be what you eat the most. Fish, chicken, eggs, and milk are also good for you, but only if you eat them in moderation. What you should eat as little as possible is food that has a lot of oil, butter, or ghee, colas or fizzy drinks, sweets, and all kinds of fast food or fried snacks. Drinking alcohol of any kind increases the chance of breast cancer. Some things may indicate the possibility of breast cancer. Let's see what these are. These are healthy breasts. This is a pulled in or retracted nipple. This is dimpling on the breast. This is a lump. Lumps can be both smaller and bigger than shown here and are usually painless. Breast skin that feels like the skin of an orange. Blood or blood-stained discharge from nipples. Screening means catching an illness before it fully develops or spreads. Let us see what the screening process for breast cancer looks like. You can screen yourself at home once every month. The best time to do this is 5 to 10 days after your period starts. If you no longer have periods, just do it on the same day each month. There are 5 steps to your breast self-exam. Screening at home. Breast self-exam. 1. Stand in front of a mirror with a good light source. Put both your hands on your hips and carefully examine your breasts. Are there any lumps, dimpling, orange peel-like skin, or bleeding? 2. Perform the same inspection with both your hands behind your head. 3. Put one hand behind your head. Examine the breast on that side of your body with your other hand. 4. Perform the same examination as step 3, but do it lying down as shown in the picture. 5. Put your fingers around your areola and press outwards towards the nipple. Do this twice as shown here. Is there blood or blood-stained discharge from the nipples? For steps 3 and 4 of the self-exam, this is the part of your hand that you need to use. Pressure area. Think of your breast as a clock with 12 sections. Use the pressure area in your hand. Check both breasts 3 times along each clock line as shown. To perform step 5 of the self-exam, put your thumb and forefinger around your areola. The pressure should be applied in the direction shown, like this. Now reposition the thumb and forefinger. The pressure should be applied once more in the direction shown, like this. Now repeat the process for the other breast. Your monthly self-exam is now complete. After you turn 30, go to your local health center once every year for a clinical breast examination. In many ways, your clinical breast exam will be similar to the self-exam. However, there are some tests that only a health worker or a doctor can do, like feeling your underarm area, your shoulder, and your back. The health center can also offer you a mammography, which is like an X-ray for the breast. It shows the doctor any small tumors that might be growing inside your breast. Treatment of breast cancer is simple, especially if detected early. If you do your breast self-examination and clinical breast examination regularly, breast cancer can be caught very early. The treatment for this is cheap and simple, and the chances of a full recovery are very high. If not detected early, surgery might be needed along with chemotherapy. Sometimes the entire breast may have to be removed to prevent cancer from spreading further. If detected late, when the cancer has already spread, treatment is still possible. This will require treatment with various modalities. Doctors will try to reduce pain and suffering as much as they can. Is there a way you can protect yourself from breast cancer? Yes, there are several. Prevention of breast cancer. One of the biggest preventive methods is to make sure that you do not consume alcohol in any form. Breastfeeding is best for both you and your baby. If you are able to do it, choose breastfeeding for all your children. Breastfeed each child for 1.5 to 2 years. Along with that, try to eat things that are good for your health. Vegetables, fruits, dal, chapati, and rice should be what you eat the most. Fish, chicken, eggs, and milk are also good for you, but only if you eat them in moderation. What you should eat as little as possible is food that has a lot of oil, butter, or ghee, cola or fizzy drinks, sweets, and all kinds of fast food or fried snacks. The best way to stay away from cancer is to catch and treat any signs or symptoms that may indicate a breast cancer. So you may perform breast self-exams every month between 5th to 10th day after your period starts. Also make sure you go for clinical breast screening every other year. And most importantly, don't ignore a symptom. If you discover a lump, dimpling, blood-stained nipple discharge, or any other symptoms of breast cancer, speak to your local health worker or doctor immediately. Remember, early detection saves lives.